Hey all you pre-healthcare students, PA students, and those interested in being a PA. Welcome to PA Coach Autumn, a channel I created to help aspiring pre-PA students. My name is Autumn, and I'm your host, and I've been a PA for almost 6 years now. I was previously in primary care for about 5 years, and recently this last year I switched to sleep medicine and pulmonology. I've continued to take tons of students, pre-PA, shadowing, just undergrad students, and they ask me questions all the time, so I decided to create this channel. Today, we're going to dive into the dynamic world of being a physician assistant, and I'm going to break this video into a few segments for it to be easier to comprehend. First, I'm going to explain what a PA even is. Is it a nurse? Is it a doctor? Is it somewhere in between? We're going to explore their education and provide a brief overview of what it takes to get that C in PAC. We're going to discuss what roles they fill and specialties they can practice in. And finally, we're going to discuss what's changing for this vital healthcare field. So let's go ahead and check it out. So what is a physician assistant or a PA? By definition, a PA is a highly trained healthcare professional who works under the supervision of a licensed physician. Think MDs and DOs. PAs are authorized to perform a wide range of medical tasks, and these include physical exams, diagnosing and treating illnesses, ordering and interpreting tests, and assisting in surgeries. And these can be cosmetic surgeries, general surgeries, orthopedic surgeries, vascular surgeries, you name it. We are advanced practice providers, and we play a crucial role in various healthcare settings. We can work in hospitals, clinics, primary care offices, pretty much anywhere you see healthcare workers, we are. We collaborate with our physicians to provide comprehensive patient care. Now, you may be wondering, where did we come from? Why was PA created? Well, historically, the first PA program at Duke University Medical Center in 1965. The goal at that time was to create a role in healthcare to address the shortage of primary care physicians, a shortage that we still have. The U.S. military was actually the first to adopt the role of PA. It was a way to enhance the medical care delivery to the armed forces at that time. You had all of these highly trained military members who were providers in the military returning to civilian life. And the PA was created to integrate those healthcare professionals into the community, and now it's become what it is today. Okay, now you know what we are, where we came from, and you may be thinking, okay, what kind of education do PAs get? Well, PAs undergo rigorous education to become versatile healthcare professionals. The journey usually starts with a 4-year undergraduate degree, and this typically is in a science-based program. Think anatomy, biology, and chemistry. It doesn't have to be that, but it usually is to kind of fulfill the prerequisites for PA school. After you get your undergrad, or during, you'll do some pre-PA type work, which means acquiring hundreds of shadowing hours and face-to-face, hands-on clinical experience. Usually this is in the form of CNA work, phlebotomy, med tech, paramedics, LPN, RN. I did CNA work personally. Then we complete a master's degree once we get accepted from an accredited PA program. This is a 2 to 3 year program. This includes classroom studies, clinical rotations, hands-on experience, and then preparing kind of to collaborate with physicians in these diverse medical settings once we graduate. And then to become an actual PA, you have to graduate and take the PANS, which is an accreditation test to get that C, that certification at the end of the PA. Now, this is obviously just a brief overview of the education. In future videos, I'll kind of dive into it deeper. Now, let's talk about my favorite part about being a PA, which is the specialty options. One of the fascinating aspects of being a PA is the broad spectrum of specialties that we get to pursue. We can go into primary care, emergency medicine, surgery, dermatology, psychiatry, sleep medicine, pulmonology. We have so much flexibility to specialize in kind of the parts of medicine that we want to specialize in based on our interests and sometimes our needs or the healthcare needs. This adaptability contributes to our invaluable role in delivering comprehensive patient care. It also means that by becoming a PA, you have this versatility and kind of dynamic changes within your career. So personally, I was primary care for 5 years. I got a really great foundation, and then this last year, I decided that I wanted to pursue a specialty in sleep medicine and pulmonology. Some PAs will spend their entire careers in one specialty, while others will transition maybe every 5 years, every 10 years. Now, the next piece I want to talk about is expansion of the field and changes. The role of physician assistants have evolved and expanded over the last few years. They are increasingly recognized as crucial members of healthcare teams, contributing significantly to patient care. As the demand for healthcare profession grows, so does the demand for skilled and knowledgeable PAs, NPs, doctors, nurses. I mean, everything is growing. The population is aging. They're going to need more of us. This expansion has led to increased opportunities, with PAs being integral in addressing healthcare challenges globally. The profession is currently undergoing some name changes as well and autonomy updates. So in 2021, the AAPA House of Delegates passed a resolution to change the official title of PA to physician associate versus physician assistant. As of 23, most practicing PAs are still referring to themselves as a physician assistant. I think eventually we'll make that change. It just hasn't happened yet. The other update is kind of our own independent autonomy. The regulations for PAs are changing. However, as of 2023, physician assistants still require some level of supervision to varying degrees depending on the state. So this is going to, change locally, state by state, even federally. So working for the VA or the government, you're going to have different levels of autonomy than you would be working at like a private dermatology practice, a surgery hospital. It's just going to vary. Right now, nurse practitioners have a lot more independence than PAs. I know that we're lobbying to change this, but as of right now, we still have that physician collaboration. And in my personal opinion, I chose this field because I liked that collaboration. I liked the idea of having this mentor, this collaborating relationship with a physician. And I've been very lucky in my career to have that as a primary care provider and now as a pulmonology PA. It's kind of a mixed bag of, what people think right now, but it is changing. In conclusion, physician assistants play a pivotal role in modern healthcare. They continue to have a solid education, they have a diverse range of specialties, and their flexibility, adaptability, and commitment to patient care contribute to the continued growth of the field. The PA profession is going to continue to be an important aspect of global healthcare. I personally have been a PA now for almost 6 years, and I love my job. Obviously, it has its ups and downs. We all lived through COVID. We know how terrible that was for healthcare professionals, but overall, I still feel like I have a meaningful career. So if you found this video informative, don't forget to like, share, subscribe, follow me for more insights into this world of kind of being a PA and other healthcare professions. Thanks for watching. Stay tuned for my next video where I'm going to tackle the difference between some of the more common healthcare fields, think NP, MD, PA, and kind of what the differences and the similarities are. So thanks for watching, and I hope you have a great rest of your day.